Good day, ma'am. I am Kyla Jalcapa and I will be doing the head and neck assessment for today. My equipments are a pen, a light, my stethoscope, a glass of water, and an alcohol. Good day, ma'am. I am Kyla Jalcapa. I will be assessing your head and neck for today. Is that okay with you, ma'am?
Yes,
So, may I know your name, ma'am?
I am Robeline Gallardo.
Okay. So, before we start, ma'am, I will perform hand hygiene first. So now that I am done performing hand hygiene, ma'am, as you can see, the room is well lighted and your privacy is already well attended. So the importance of this assessment, ma'am, is for us to know if you have any problems with your head or neck or any developing illnesses in your body that we need to focus on or get treated immediately. So I can assure you, ma'am, that after this assessment, all the results will be confidential and will only be discussed formally with other healthcare professionals. So you don't have to worry, ma'am. So now we will start. So may I know, ma'am, if you experience neck pain? What about headaches, ma'am? So may I know, ma'am, if you have any past problems with lumps or bumps, itching, scaling, or dandruff in your head?
No, ma'am.
So do you have any difficulty moving your head or neck?
No, ma'am.
Do you have a cough or difficulty in swallowing?
No, ma'am.
Do you have any history of loss of consciousness, dizziness, seizures, facial pain, headache, or injury?
No, ma'am.
Is there a history of neck and head cancer in your family? Is there a history of migraine, headaches in your family? So now, ma'am, I will be inspecting your head first. I will inspect for its shape, size, and configuration. So her head is symmetric, round, and erect, and it is in midline. It is appropriately according to its body size, and there's no presence of lesions in her head. Now I will inspect for the involuntary movement. So would you mind if you face me, ma'am? So her head is still and upright, and there's no presence of involuntary movement at all. So now I will check for the head. So there is no sign of infestation or skin condition. There is no lice nor dandruff, and there's no presence of baldness in her head. So now I will inspect for the face. I will inspect for its symmetry, feature, expressions, movement, and also for its skin condition. So this is important to check if there is abnormal movements like twitching of the face that is involuntarily. And also to check if the face is symmetrical and if there is no drooping on one side. So ma'am, can you please close your eyes tightly and then open them up? Okay, so can you smile for me, ma'am? Okay. Can you frown and then puff up your cheeks? So do you feel tenderness or pain? So we can see that the cranial nerve is properly working, the face is symmetric and it is round in shape, and there's no abnormal movements at all. Now I will palpate for the temporal artery. Her temporal artery is elastic and it is not tender. Now I will palpate for the temporomandibular joint. Can you please open your mouth, ma'am? Try it again. So there is no swelling, tenderness, or crepitation with the movement of her temporomandibular joint. Now I will proceed assessing your neck. I will inspect your neck while you are in a slightly extended position. So I am gonna use a light for position symmetry, presence of lumps, or masses. So we are doing this, ma'am, to be able to look into the trachea and to see if there's any lesions or thyroid problems like AG problem. So in her case, there's no presence of lesions in her neck. The neck is symmetric with head centered and without bulging masses. Now I will inspect for the movement of the neck structure by having the patient swallow a sip of water. So the thyroid cartilage and the cricoid cartilage move upward symmetrically as the client swallows. Now I will inspect for the cervical vertebrae by having the patient to flex the neck. So chin to chest. So ma'am, can you look down for me? Can you look down? So the client C7 is visible and palpable. Now I will inspect for the neck range of motion. So can you turn your head side to side, ma'am? And then look down and then look up. Okay. Now touch each ear to your shoulder. patient has a normal neck movement. It is smooth and it is controlled. Now, I will palpate for the trachea. So, the trachea is midline. Now, I will palpate for the thyroid gland. Can you please swallow, ma'am? Okay, can you try it again? Do you feel any pain, ma'am?
No, ma'am.
So the patient's thyroid gland is normal. The lobes are smooth, firm, and non-tender. Now I will auscultate the thyroid gland. I'll be using the bell of my stethoscope for this procedure. No bruits are auscultated. Now, I will be assessing the lymph nodes of the head and neck. I will palpate for the lymph nodes for its size, shape, elimination, mobility, consistency, and tenderness. Okay, so ma'am, please tell me if you feel any tenderness or pain. Okay, so preauricular nodes,
None.
postauricular nodes,
None.
occipital nodes,
None.
tonsillar nodes,
None.
submandibular nodes,
None.
submental nodes,
None.
superficial cervical nodes,
None.
posterior cervical nodes,
None.
deep cervical chain nodes,
None.
supraclavicular nodes.
None.
So there is no sign of swelling or lumps. The patient doesn't feel any pain while palpation. So now, ma'am, I am done assessing your head and neck. Again, ma'am, I can assure you that all the results that I've gathered from this assessment will be confidential and will be only discussed formally with other healthcare professionals. So you don't have to worry, ma'am. So thank you for participating, ma'am, for this assessment. And once again, have a good day.